One of the biggest issues facing America today is the reform of our healthcare system. While Americans continue to see some of the best healthcare services in the world, it's not accessible to everyone, everywhere. And our current delivery system and spiraling costs are not sustainable in the long term. The presidential debates have left no doubt about the importance of this issue in the 2008 election, and the Democrat candidates have been competing about the degree of government takeover that they support. But any nationalization of healthcare system risks going down a well-traveled road that other developed countries have already blazed, and which has proven to be a failure. See, I've lived under national health plans in England and Italy, and we've experienced healthcare delivery under those systems. I know the reality that dispels the myth of free healthcare. It doesn't work there, and it won't work here. Americans would not tolerate the compromises that Europeans have had to make to sustain their national health plans. First of all, free healthcare is a lie. Michael Moore's movie didn't admit the fact that every working person in England, for example, pays national health charges as a payroll deduction, a tax out of every paycheck. In addition, the national health system rations care by utilizing waiting lists. The government budgets health care in the same way that the U.S. budgets for defense or roads, bridges, or other services paid out of tax dollars. Just say, for example, that the budget provides for 100,000 of a certain treatment in a given year, and you're number 356,412. Well, you know that you're going to be waiting for 3 years for your surgery unless a number of people ahead of you in line die before they get theirs. To take the pressure off the National Health Service and the government, European countries have developed private systems and private health insurance. People with private insurance or sufficient wealth opt out of the national health treatment and get treatments right away by private doctors at private hospitals. Now that system sounds a lot like the U.S. system, and it is. Why would we try to fix our current private system by developing a government system when every country that has a government system has had to allow a private system to develop in order to take the pressure off their government systems? Shouldn't we just find a way to improve the private system with a private market solution? We can do that. We can drive down the cost of private health care, and with it the cost of Medicare and Medicaid, by increasing the amount of information available to patients about price and outcomes of procedures. By allowing regular people and their doctors to know what the price differences are at various providers and what quality differences there are so they can choose how much to pay and where they're likely to have the best results. These solutions are not pie in the sky, but are being tested all over the country and are being successful in many states in driving down the costs and driving up the quality of health care. And they all have several factors in common. They push more information and decision-making to the people who actually receive the service. They allow for more competition and more innovation in healthcare service delivery models. And they encourage health and reward healthy choices to reduce illness rather than just providing health care after people are already sick. These are changing times, and healthcare reform requires dramatic solutions. But there's no reason to believe that a government takeover would provide a better system. We need private sector solutions and a competitive market system to let American innovation do for healthcare what it has already done for so many other parts of our economy. By energizing the American imagination and innovation machine, we can fix healthcare without accepting a big government takeover and without creating a bigger government bureaucracy.